everyone, and welcome to Talking Mental Health, a segment from the Wellness Project where I interview mental health professionals on all things mental health and wellness as they relate to college-aged young adults. Today I'm here with Samantha Revell. Samantha is an art therapist, yep. Sam, do you mind introducing yourself to us?
Yeah, of course. So, hello, my name is Sam. I am an art therapist. So, I work with a lot of times when I introduce myself and I say that I'm an art therapist, people, one of their first questions is, "Oh, you work with kids." And that is true. I do work with kids, but I also work with adults. Art therapy can be used for any population, any age. And yeah, I work at a private practice. I'm currently in my studio, and it's not mine, but the studio within the practice that I work for. But yeah, I'm just excited to talk to you guys about what art therapy is and what I do. And yeah, that is me.
Yeah, I was telling Sam before we started that I'm excited for this episode because I feel like we've done so many episodes on like diagnoses, and in those episodes we're like, what are some common treatments? What are some things we can do? But we never go in depth really on like what those treatments are other than just like a general overview. And so I'm excited to talk about a couple of them today and kind of expand our knowledge on these options of things we can do. So we've got some art therapy stuff as well as some CBT stuff going on in here. So if you're ready, Sam, I'm going to get started.
Yeah, let's do it.
Okay, so we're going to start big because like you said, not everybody knows what art therapy is. So what is art therapy?
Yes. Okay. So art therapy is essentially when you think about, so it can either be art as therapy or art within therapy. So
Okay.
art as therapy would be, for example, like using art as a tool to relax, or like it would be like an open studio. It doesn't require an therapist. It's just utilizing art as therapy. So, like going to a pottery class or like an open studio and just making art for the purpose of it being relaxing, or like for you to express yourself. That is more art as therapy, but art in therapy is more like what you would imagine as like traditional therapy, where you go and you have treatment goals and maybe you have a mental health diagnosis, and the art therapist you helps you to like achieve those goals, but we just utilize art within the therapy too. So we don't, a lot of like misconceptions about art therapy is that like there's this like prediction quality where like you make art and then I look at it and I can tell you like what it means and like what you're feeling, which isn't the case really. It's just kind of an extension of, it's just another way to communicate within therapy. So it helps with, I mean, all kinds of populations it's good for, but I work a lot with kids, and it's just a cool way to like expand your way to like release and let out emotions besides just having to talk about it, because that for one can be really intimidating.
Mm-hmm.
And sometimes we don't know how to verbalize our feelings. So utilizing another tool to express them can be beneficial.
Yeah.
So that is essentially what art therapy is.
Yeah, and I love that distinction you kind of added in there of like art as therapy or art in therapy, because I hadn't even really put that together yet. That like some people do use that as like the way an outlet,
Yeah.
going to those classes, doing the things, but then that like actual therapist led time of art in therapy. That's how you worded it, art in therapy.
Mhm.
Um, so those, oh gosh, that was I'm already
Yeah.
so.
So an example of art as therapy that a lot of people do would be like a coloring book at home or something like that. But so that's another misconception that people think. They either think that I make art for people and they watch and they're like, oh wow, this is so relaxing. Is that what you do? Um,
Mhm.
or they think like, oh, you teach art to relax, or it's a little bit confusing. I understand why people don't know what it is exactly, but basically it's like somebody will come and they'll say, these are the things I'm struggling with. We will develop a treatment plans like you would in regular therapy, like reduce anxiety and develop coping skills, increase assertive communication, and uh, develop, a more healthy relationship with, my sister or whatever. And then we just use the art within it to like make it more fun, make it more accessible, and like just have another way. So, a really like easy example would be like when I first start seeing someone, something I like to do is like create a feelings wheel. So, I just ask them to think of like their top 5 most common emotions within your last week. So, like on a day to day or within the last week, which 5 emotions do you feel most often? And then they kind of like divvy it up into a pie chart. Um, so one, it like becomes visual, and like we can see together, like, oh, like I realized, like, wow, I've had people like only put negative emotions on there and like put the tiniest sliver of happy, and then they're like, oh my goodness, like I didn't realize like how much like looking at it so starkly really is making me see that like this is a big thing that I'm dealing with.
Mhm.
But so that's a really simple example, and that aligns more with CBT. So if you haven't heard of CBT, it's cognitive behavioral therapy. Um, so it basically means that it's a type of therapy that's used across all types of therapy, but it's common. It's like the most not statistically proven, but like research based therapy model. And so the idea behind it is like thoughts are connected to our emotions, which are connected to our actions. So, like, it's basically like breaking down our thoughts in order to change our emotions, which will change our actions.
Mhm.
So, like, the breakdown of your emotions pie chart is like kind of a cognitive way of looking at like all of my
Mhm.
feelings. Um, so there's this whole other part of art therapy that's more like sensory based and like more about like experiencing affect and less cognition because we like experience emotions in our body. So like being able to tap into that. Um, I'm trying to like explain in a cohesive way and
You're good. I think this is
jumping all over
it's
the
great.
place.
You're good.
Yeah. So,
Yeah,
do
so,
you have a
I mean, I
question?
think no, you're right. I think that I loved the kind of the way you made those connections too about CBT and, like, this is the way, kind of explaining the way they go hand in hand a little bit. I'd love to know a little more about that. Well, first, there was just I feel like there's so many things I wanna comment on, and I'm getting ahead of myself. Um, I love those examples because I think that they are so easily, like, applicable to our understanding of what these therapies are, and the differences between them. For one, I think that those were great examples, and I wanted to thank you for those because I think sometimes we get lost in like the jargon. We get the this is what this is. Here's the definition, and then taking that step of going and doing it is scary. Like yeah, I heard what it is. They explained it to me, but I don't actually know what I'm gonna be doing when I walk in that room. And so I love the examples that you added there to kind of give more clarification on what it looks like. Um, Yeah, so I'd love to know more about because when we kind of talked beforehand about what you do, we talked about how you use kind of both in your practice. And so I'd love to know more about
Yeah.
how they're tied together.
So the main like kind of difference between art therapy theory and CBT is CBT is very cognitive. So it's like it's very structured. Um, Imagine because like the whole point of it is to identify thoughts and then not rewrite them, but like reconfigure them into like a more kind is the wrong word, but like, so for example, we have automatic thoughts often. So, an example of an automatic thought is like, I suck, I'm terrible at this, I'm doing an awful job.
Mhm.
And it's just something that, like, maybe a trauma has kind of created that automatic thought in us, or maybe it's just the way that we've been treated within society. But everybody has those kind of like automatic thoughts that are negative. So the with CBT, the idea behind it is like being able to identify those automatic thoughts and kind of like rewrite them. So the example would be, I suck, I'm terrible at this. So like the first step is just like noticing like, hey, I'm experiencing this automatic thought, and then not judging yourself for it, and saying like, that's okay, like it happens. I am not my thoughts. And then after that, you would try to restructure the thought. So you might think like, um, I'm doing my best, I'm trying, or I'm doing what I can today, or it's okay to make a mistake. It's basically just like, because the automatic thought of I suck leads to the emotion of like despair, right? But
Mhm.
if we can like help ourselves adjust the thought, then the emotion doesn't become despair. It becomes like kind of like, okay, like I feel all right. So that's kind of like the basis of CBT in a really nutshell, but it's very cognitive and it's very structured. And sometimes it feels non-affirming because someone might say like, this is how I feel. I feel like I'm terrible. And it can feel like you're just saying like, no, you're not. You're not. You're great. And it's like you're kind of shutting down what they're saying, and um, like not, and you're not affirming that feeling that's coming from somewhere. So the reason I love art therapy is because it kind of, I mean, you can do this with other therapies too. You can make it more person centered, but with art therapy, it's fun because, um, so for example, let's see, um, like we can really tap into like just the expressive quality of art making and make it, it can be really validating for feelings. So it doesn't have to be all about the structure and all about like you can change this thought and make it better. It can be like, let's take a moment and just honor those feelings. I'm going to put a huge piece of paper on the wall and we're going to finger paint, and I want you to express what you're feeling using line, shape, and color. Maybe that looks like, like a really, dark hole and like, scratches all over the wall, or it looks like a bright thing. But there's no right or wrong within art therapy. It's almost like when someone first starts coming, the first thing I want to do is kind of like not erase, but like adjust their expectation of what like art making is. Because in this space, it's not about making something that's beautiful or something that I'm going to put on my wall, or like something that's like traditionally art beautiful. The goal is just to express. So, like, if that means ripping up the paper and burning it, then let's do it. Like, we don't need to like make it beautiful and put it on the wall. But that's kind of the first barrier that a lot of clients have, is just like, I feel like I'm not good at art making. I feel like capable, I can't do this. But then something so cool about art therapy too is that like just through that of the process of getting someone the freedom or willingness to like create openly and not be judgmental of themselves is like such a huge, like it's like a practical way in therapy to practice self-efficacy, because
Mhm.
like you're allowing yourself to like make something and not judge it, and like it gives you a sense of freedom almost, because like it's okay to feel these things and like make it however I want to make it. Like I don't have to listen to what someone else tells me. Um, so I forgot what the original question was. I went on a little bit of a tangent.
No, you're okay. I think you answered it. I was just kind of talking about the connections between the two and how they work together, but I think you answered it. Yeah, gosh, I love listening to you talk about it too, because you can kind of like see your passion for it through your answers, or hear your passion for it through your answers, which I
Yeah.
just love to listen to. Um, I'm gonna put you on the spot for a second, because I do think it's important sometimes when we use words that like may not be known to everybody to explain them. So you did use the word self-efficacy, and I was wondering if you'd be able to kind of just give a quick like explanation of that
Sure.
word.
Yeah, so self-efficacy is just like the fancy therapy term for like feeling like capable and like accepting of yourself. So it's kind of just like self-esteem, but it's more so just like um when I think of self-esteem, I think more of like how you about yourself, like, oh, I feel good about myself. But self-efficacy is more like you're fair with yourself and you like are accepting of yourself. Is how I imagine it. But you're right, it's one of those like fancy therapy terms
Yeah,
that
and
might not
I
be what.
mean, you just never know, and so I think it's kind of like when you give a
Mhm.
presentation for the first time, it's like one of those things, like, never assume your audience,
Yeah.
knows all the things on there. We would talk about that a lot at my field work, so it popped into my head. But thank you for giving kind of a quick
Yeah.
explanation of it. Yeah, I'm trying to think of where I wanna go next. I'm a little curious because a lot of times when we talk about art, we talk about, like, the arts as a chunk,
Mhm.
music, drawing, painting, like, there's different types, and so I'm curious, like, is there art therapy and, like, different kinds underneath it, or is there art therapy and music therapy and, like, are there different kinds? I don't know.
It's a good question. Yeah, so there's music therapy also. You can get a music therapy degree. And um there's like a little bit of like friendly competition, not competition, but like music therapy, you don't have to get a master's degree, and art therapy, you do. So like sometimes, like when I was getting my master's, it was just like I was. It's silly. It's just it's. I'm trying to. I'm thinking of just like working with music therapists within. It's just different in that music therapy is more. I guess that I'm having trouble explaining what I'm saying.
You're
But
okay.
yes, there's two different things. There's music therapy and art therapy, and it's kind of similar where music therapy is like music as therapy or music in therapy. So I've worked with like a lot of music therapists. Their scene is more like inpatient facilities because
Okay.
they like work with a lot of like I mean art therapists are in this way too. Private practices don't exist much for art therapists. But I guess what I'm trying to say is like art therapists, it's really rare to have like an art therapy private practice. And so typically an art therapist will like niche themselves into like a therapist job. They'll like find a job online that's like mental health counselor and then they'll niche their way into it. And they're like, I can do that, but also I can do art with
Mhm.
you. But music therapist is more like its own thing. Like people will hire music therapists for hospitals or psychiatric centers or schools or
Okay.
it's like they wouldn't like apply for a mental health counselor position. Does that make sense?
It does, because I think that's just, like, my brain is always like, "Well, there's lots to the arts," There's more than drawing, painting, all the things, and so my brain's always curious on how that transfers to, like, other types of therapy
Right.
as well. Yeah.
Yeah, and so the degree that I have, I'm qualified to get my license in mental health counseling.
Mhm.
So like we take like all of the same curriculum and classes that would be needed to have like an LMHC or like a counseling degree. But we just learn how to utilize art within it. So it's like, and it's like it's for job security, but also for like the validity of the field because like we're like art teachers, we are therapists,
Mhm.
and a lot of people don't like realize that. So anyway, yes, but within art therapy, to answer your question about like different art materials, I use all kinds of art materials. When I first interviewed, when I was in college and like trying to decide if I wanted to get a degree in art therapy, I interviewed an art therapist who worked at a hospital, and I remember her telling me that she was building a chandelier with one of her clients. And so it's really like dependent on the person. Like you want to like if they're like, this is symbolic for me, and it's like they have the like confidence and like the creative problem solving to be like, I want to try that, then like I'm not gonna say no. So, but
Mm.
also an interesting thing about materials within therapy is there's kind of like we learned about this in school, but basically there's like a range of fluidity in a medium to rigidity. So like based on how rigid a material is or how fluid it is. And the reason that's important is because a more fluid material is like less controllable. And so that can be anxiety provoking for something to be like not controllable. It also has a sensory element. So if you are on the autistic spectrum, you might have like sensory aversion. So that's a good thing to consider. And also, like the more fluid a material is, generally it can have someone regress a little bit, which can be good. So imagine like finger painting. You might like become a little bit more like energetic because it's like there's something about like the sensory experience. I don't know if you've ever done that, but if you put paint all over your hands and yourself to just like paint, um, it like kind of like makes you feel a little bit like the, I'm rambling, but like the
You're
sensory
okay.
aspect one is relaxing, but it can also make people regress, which can be a good thing because it can allow emotion to come out. Um, so like touching on some psychology theory that you might have heard of, you know how I don't really like Freud, but you know how he talks about the like anal stage and stuff, and like, do you know anything about psychology?
Not much, not much.
Um, okay, well, basically, it talks about like how kids or like when you regress, it's like I don't know. Anyway, I'm gonna cut over that part because it would take too long to explain. But so like a more fluid material would be like clay or paint, and a more rigid material would be like pencil or marker.
Okay.
And then there's also like we consider like kinesthetic movement and also affect and like how cognitive a directive would be. So like kinesthetic just means like you're moving your body, and so art therapy encourages you to have you talked to other therapists about like how emotions live in your body and like you experience like tension and like
I don't
those types
know
of
that we've, like, covered it in full. I think there's been, like, whispers of it in certain episodes, we've never just really talked about it.
yeah, so like that's another cool thing about art therapy because it's like a resource to be able to like have that body movement, and I could talk about it for days, but so an example would be like if a kid was super angry and like they had all this like pent up tension, we might like put a big piece of paper on the wall and do like a scribble drawing and like allow him to release the anger on the paper, and then it's
Mhm.
teaching him like, okay, it's all right to feel angry, and this is a positive way to let it out. So we don't have to hold it in, but instead of yelling about it, why don't we rip up this paper, or we can make a huge scribble. So it's like that anger is living inside him. He's very tense. And so like releasing that in like a bodily way, in like a kinesthetic way is good. And then but is getting into like a lot of art therapy theory that would take a long time to explain. But do you do you have another question? I feel like I kind of like go all over the place
No, it's okay
answering
because
things.
the kind of way that your thoughts move throughout the questions are actually answering other questions I have, so it works out because I'm like, "Oh, I wanna ask you about this," and then you start talking about it, so it's perfect. Um, yeah, I there's so many things that I wanna pull out of there. One, I definitely loved you talking about, like, the paint on your hands. I was a preschool teacher for a few years, so I've definitely done stuff like that with the kids in the past, like that feeling of having paint on your hands.
And you might have noticed that they like get a little bit crazier when you do stuff like
Mhm.
that. And it's
Yeah.
because it's like it's like a release of like tension and feeling, so it like causes you to like regress a little bit.
Yeah. I mean,
So,
even as an adult, I was like, "Oh, this is very cool."
yeah, no, it's
Feeling
great. So
it.
like if I have, but you also want to be careful because if I had someone who came in and was like like it could be so coming to the point of like panic attack, because if they're so anxious and so tense and like that, you have to like gradually get up to it where it would be able to like do that and feel comfortable and like feel willing to like feel that out of control. Um,
Yeah.
because that's kind of a like ongoing talk within therapy kind of often is like, what do I have control of? What don't I have control of? Taking control of things in your life is like can be both a healthy coping mechanism and an unhealthy coping mechanism depending on how you're doing it. Um, so like anyway, I'm getting off track.
Yeah. No, you're okay, you're okay. I tell people all the time that I love the long answers. Like, I'd rather ask you a question and you give me paragraphs of an answer than, like, a yes or no, you know? So I'm here for it. Yeah. I do think, though, I think I'm gonna go ahead and end it, here. I think that that was great information because I think with a lot of your answers, you kind of painted this picture of what happens when you go in that room. Um, some of the reasonings behind art therapy, the things we see, the reasons we do them. Um, yeah, I think I'm gonna go ahead and start there. So thanks stop there, not start there. It's the end of the day. So thank you for being here and giving us all that information on art therapy, CBT, how they intertwine. I really enjoyed the
Yeah, of course.
yeah, and thank you to everyone who's watching. Bye.